Implants are the preferred option for those who are looking to repair lost teeth or secure dentures. Yet, a majority of patients aren't interested in dental implants due to worries over costs. In this clip, we'll explore the price of dental implants as well as look at the elements that affect cost. What are dental implants? Implants for dental purposes are synthetic tooth roots which are surgically inserted within the jawbone in order to help support a new tooth or bridge. They are composed out of titanium. It is an extremely durable biocompatible substance that joins the bone and creates strong and solid base to support the replacement tooth. Dental implants are regarded as the most reliable option to replace teeth since they feel, look, and function just like real teeth. Dental implants cost money. Cost of dental implants may vary according to a number of variables, including the number of implants required as well as the material that is used and the area of the dental practice. In general, the price for one dental implant ranges from $800 up to $3,000. It includes the price of implanting the implant itself, surgical procedure to place the implant, and also the dental restoration or replacement tooth to be bonded with the implant. Aspects that could impact the cost of dental implants. A variety of factors influence the cost of dental implants. Some factors include implants. Number of implants. The more implant need to be used, the more price. As an example, replacing one tooth by implant surgery will be cheaper than replacing the entire set of teeth missing by using several implants. Materials used. Quality of material used in the implant as well as the reconstruction will affect the price. High-quality materials can be more costly, however they can give better long-term results. The location of the dental facility. The location of the dental facility may also influence the price and the purchase of implants. Dental clinics located in urban areas or areas that are expensive could charge more for procedures compared with clinics situated in rural regions. Other procedures. In certain instances, further procedures could be needed prior to or following the installation of dental implants. These include surgery for bone grafting or treatment for periodontal disease. Additional procedures could be added to the total price of procedure. Insurance coverage for dental implants. A majority of dental insurance plans do not cover the total expense of dental implants because they're as a cosmetic or elective treatment. Certain insurance plans will cover a percentage of the costs if implants are medically needed. It's important to consult with your insurance provider in order to know what's covered under your policy. Financing options for dental implants. If the price of dental implants are an issue, you can find financial options to reduce the expense of this procedure. Dental clinics often have payment plans and financing options to allow patients to take care of the procedure over duration. Furthermore, some financing companies are specialized in financing dental procedures and offer financing options for patients of different credit scores. Conclusion. Cost of dental implants may vary according to a number of variables, such as the number of implants needed, components used, as well as where the dental practice. Even though dental implants are costlier than other replacement alternatives, they are long-lasting and natural-looking solutions for people who are missing their teeth. If you are concerned about cost, then it's important to investigate financing alternatives or payment plans to assist in making dental implants affordable. All in all, investing in dental implants could boost the health of your mouth assurance as well as the general quality of your life.